In the previous session, we have discussed the introduction, functions, and the different types of classification based on the following: position or region of the bones, shape of the bones, gross structure of the bones, microscopic structure of the bones, location and development of the bones. Now, let us discover the terms used for describing bone features one by one. Linear elevation can be in the form of line, crest, and ridge. Line is smooth like in superior nuchal line and inferior nuchal line of the occipital bone. Crest is broad and rough area on the bone like in the iliac crest of the hip bone, crest of spine of scapula, and ridge is rough linear elevation like in the medial and lateral supracondylar ridges of the humerus. Rounded elevation can be in the form of tubercle, protuberance, tuberosity, malleolus or trochanter depending upon the shape and size of the projection. The elevation exactly need not be rounded. Tubercle is a small rounded projection or bump on a bone. It is a type of protuberance that is often used as a point of attachment for muscles, tendons or ligaments like pubic tubercle, greater and lesser tubercle of humerus. Protuberance is a rounded projection or bump on a surface such as external occipital protuberance at the back of the skull. Tuberosity is a rounded prominence on a bone such as ischial tuberosity of the hip bone, deltoid tuberosity on humerus. Malleolus is a bony prominence on the ankle such as medial malleolus of tibia and lateral malleolus of the fibula. Trochanter is a large blunt process on the bone such as greater and lesser trochanter of the femur. Sharp elevation, as the name suggests, it is any sharp projection of the bone. It can be spine or styloid process. Spine is a sharp elevation which can be seen in spinous process of vertebra, ischial spine and anterior superior iliac spine. Styloid process is a bony projection from the base or shaft of a bone such as styloid process of radius and styloid process of ulna in upper limb and styloid process of the temporal bone. Expanded ends for articulation can be in the form of rounded projections like head or condyle. Head is a rounded, smooth projection for articulation as seen in head of humerus, head of radius, and head of femur. Condyle is a rounded articular surface on a bone that forms a joint like medial and lateral condyles of femur. Epicondyle is knuckle-like process projected on the condyle, which is small non-articular part such as medial and lateral epicondyles of femur. Facet is a small flat area for articulation such as the facet on the head of rib articulating with facet on transverse process of vertebra. Superior and inferior articular facets on the vertebral body. Depressions are of three types: notch, groove and fossa. Notch is a small indentation or narrow depression such as greater sciatic notch which is deep and lesser sciatic notch which is shallow and below to the greater sciatic notch on the posterior border of hip bone. Groove or sulcus is a linear, long, narrow and shallow channel or furrow such as bicipital groove between the two tubercles of humerus. Fossa is a concave or indented area such as radial and coronoid fossa on anterior aspect of humerus, olecranon fossa on posterior aspect of humerus, and acetabular fossa on the lateral side of hip bone. The openings are of different types depending on the shape. Fissure is the linear opening such as superior orbital and inferior orbital fissure. Foramen is a round opening as infraorbital foramen of the maxilla and foramen magnum at base of skull in occipital bone. Canal is elongated opening passing through the bone having two ends like carotid canal of temporal bone. Meatus is a passage or opening leading to the interior of the body such as external acoustic meatus in the temporal bone. With this, we complete the terminologies used for describing the bony features. In the next session, we will discuss the structure and parts of the long bone.